12:30, so
Yeah.
we can probably get underway. I'm up here to introduce my colleague. So good afternoon to you all. I'm glad to see you all here today. I think there are some people online as well. It's my pleasure to introduce my friend, my colleague, Dr. Jared Grant. Jared is an assistant professor in the Department of Agricultural, Environmental, and Developmental Economics. He's a proud grad of Florida A&M University, having earned a BS in agribusiness. He went on to earn an MS and PhD in agricultural and applied economics from the University of Georgia. Jared's research interests include food accessibility, food insecurity, game theory, and behavioral economics. He is currently working on a project that involves the creation of a variation of the trust game that implements a Bayesian game theoretic model. The model examines how residents trust in government influence store operators' decisions to open and maintain grocery stores in low-income and low food access areas. His goal is to understand and improve food access in underserved communities. Relatedly, Jared and I have been engaged in very promising conversations around understanding innovative approaches by nonprofit organizations to combating food insecurity in places like Chicago. Having gotten to know Jared's work and spent a lot of time talking with him about his work, I know he is at the forefront of understanding food accessibility and improving access to those for those most in need, and it's an honor to have him in the Glenn College with us today. So please join me in welcoming Jared as he presents.
First, I gotta thank Dr. Wilson for the great introduction, and thank you all for allowing me to present something. It's the first time I'm presenting this paper, so I'm excited. This primarily focuses on the food accessibility, food security aspect of my research, but yeah. So pretty much broadening out what is SNAP, for those who don't know, like it's the Supplemental Nutrition Assistance Program. It was originally or formerly called like food stamps, and it's where you can like purchase like pretty much food through like EBT for like low-income households. Notice I said like food, not healthy food, because there's disputes on whether like one, you can get pretty much some unhealthy things through SNAP, such as like snack foods. So, and a lot of research has highlighted minimum like debates on whether they actually alter like whether you actually eat healthy foods, which that's common for everyday Americans, but also just for low-income people, where it's kind of like they have a higher chance of getting obesity or health-related issues that can be impactful. But one way to kind of like encourage them to eat healthier is to offer price incentives. And broadly, this price incentives are known as like SNAP healthy eating incentives. And pretty much the main primarily goal is to make sure that, hey, if I'm food insecure, I can get fruits and vegetables, and price is an issue for me, even at the discounted price of SNAP, further encourage. So below, and there's various programs, such as ones that focus on fruits and vegetables, one I'm going to talk about. There's also one for dairy, grain, and pretty much this kind of like just showcases an example of how it works, which came from this source. But pretty much extra funds for it. You get to purchase more fruits and vegetables. By that logic, more fruits and vegetables are eaten, actually improving your health and well-being and limiting your risk of having dietary issues. So the one that I'm specifically going to talk about is called GusNIP Nutrition Incentive Grant Program, or Incentive Program, or GusNIP. It was named after an economist who passed away in like 2017, but they named it after him. And pretty much what it does is offer an immediate discount on SNAP allowable foods, specifically for fruits and vegetables. It was established in 2019. Actually, prior to that, it was called Finney in Detroit, where it was piloted. And it pretty much offers various programs such as produce prescription, which if you know the food is medicine literature, that's major in it, but also nutrition incentives, which primarily focuses on literally funding people to allow them to have healthy foods. One primary example of it to the left is the Double Up program, which if you've been to like some farmers markets, it's pretty much doubling up on your SNAP dollar. But there's other variations. Primarily, they're like farmers markets, but there are some brick and mortar. which you can go to the grocery store and pretty much use your SNAP benefits and offer them like that. And recent studies have highlighted there's some positive impacts regarding like actually altering what you eat. Like all SNAP participants actually eating healthier foods, such as in Rhode Island, where people will spend on average like $10 more on fruits and vegetables at SNAP at a GusNIP retailer. So, oh, and feel free to interrupt or questions, comments. So I've mentioned the benefits of GusNIP. Now I'm gonna talk about cons of GusNIP. It's very, very competitive. And that's primarily because and funding only lasts a minimal amount of time, a couple of years. The idea is, hey, we're gonna alter people's eating behavior. Once they kind of get used to it, it's kind of like if you have Apple Music, how you have 90 days for free. And then after your 90 days, you're kind of like adjusted, so you can't, like you're kind of stuck in it. So that's kind of like the mindset or the hope for it. So for requirements, and the two major ones for like the whole big grant is one, it must be in an underserved community or in a high need community. Secondly, there's a match requirement, meaning they'll pay this half, but either through another sort of funding, you have to secure that. So those are two major things. And then once that's even secured, then they have to decide which retailers are going to offer GusNIP. Specifically, one that focuses on, like, first you have to be able to accept SNAP or EBT, which some farmers markets do, some farmers markets don't. So that's a big point. The second, which kind of feeds into the first one, is adapt a point of sale system, meaning you have to be able to actually like how when you go to a register, like have a system, like you can't just accept cash. It has to be a way to like showcase where it's coming from, SNAP redemptions, things like that. And then lastly, similar to the first point, must be located in an underserved, high need community. Yep.
So you're mentioning farmers markets. Would Worthington Farmers Market apply as a collective to get this grant? And then, or would it be like individual retailers that have stands that have fruit or whatever? It sounds like it's the collective that would apply.
Great question. Yeah, and actually in Ohio, there's a nutrition incentive known as ONIN, which is big in like Cincinnati, Columbus, like here in Columbus, but also in Cleveland. Yeah, it's a collective of of people over this, and then they pretty much talk to farmers markets, talk to specific ones, see if they meet these requirements, and decide where they want to say, hey, we have this grant, we're willing to fund that. Great question. So the big thing is highlighting must be located in an underserved, high need community. But what exactly is high need? So like, is it based on access? Is it based on health disparities or race, ethnicity? It's kind of left broad with some, like when you're applying, you can state, for example, hey, this is what I determine as high need, but for the most part, it's really broad. And this brings me to the point of the question. So food insecurity in terms of the Black community is, as you can see in the second bulletin, is there's over 9 million, which actually the statistic is 1 in 4 Black people suffer from food insecurity in the US a year. And what's interesting is, since GusNIP is primarily focused on being placed in underserved communities, how does this impact where historically predominantly Black communities have suffered from a lack of resources, access to things? For those who are familiar with the redlining literature or the concept of residential segregation, where it's kind of like you're purposefully segregated from here and you're lacking these resources over here. So that's more broadly. And more than likely, how I highlight right here, they're more likely to have higher rates of obesity compared to like white communities. So I need underserved areas be interesting given the lack of access to these communities going on. So this brings me to my big question. Do Black neighborhoods have fewer or fewer SNAP nutrition incentive programs compared to like location or neighborhoods? And the way I'm kind of focused on this was to primarily focus on the availability or access part, which is measuring the proximity of GusNIP retailers and seeing if it's associated with various characteristics of Black population, such as where you are, like the regionality, health needs, or characteristics such as obesity, high blood pressure, whether you have insurance or lack thereof. And then lastly, residential segregation measures, which I'll get into in a minute. So I'm already going to give you some preview of the results. So in regards to Black neighborhoods compared to whites, and what we've done, we found that they have fewer GusNIP retailers within their specific census tract or area compared to whites, but they're actually closer to an incentive location if the neighborhood doesn't have an incentive, meaning it's not in your census tract, but it's nearby. And when we dive deeper, because we did some subsampling, if it's less than 5 miles, then we see the negative correlation, meaning that or positive correlation where they're farther away. Neighborhoods in highly segregated counties are still less likely to have a SNAP incentive or nutrition incentive. And Black neighborhoods that actually lack health insurance are actually significantly closer to a GusNIP retailer compared to the other health disparities.
Yep. Just to think about some of the stylized facts you were saying with respect to farmers markets in general, is there like a particular reason these tend to be at farmers markets? Is it like intentional about the program, or is it that some of the characteristics that they made for program eligibility happen to like make it easier for farmers markets? I'm just trying to think through like where you'd want to put cheaper food versus where you might be limited to if for some reason this was like actually tied to farmers. Like, well, because they have to be pre-existing in the area.
It's technically like 3 factors.
Okay.
One with like specifically like when you look at like SNAP redemption, technically supermarkets, supercenters offer more like SNAP gets redeemed there.
Yeah.
Issue is with the grocery store, like it's a chain. So it's kind of like if you like, for example, if Walmart offered this, you have to go all the way up to headquarters, things like that, and the amount of money may be bigger. Versus with a farmer's market, it's more like, okay, this location, like it's more independent.
Yeah, I guess, is that restriction because the GusNIP program has not a lot of money? Like, I feel like Walmart would want their customers, some portion of their customers to be able to get some portion of their products at like twice the subsidy. They'd be like in for that. So like, if they were gonna submit an application, they'd get denied because like all the grants need to be less than like $1 million or something.
Good question. That deep, I'm not exactly sure.
Different way I see is like why it isn't Walmart.
Yeah.
doing it.
Yeah, who are the retailers? Do you have will you show us that?
Not specifically, but one, for example, is like Safeway.
Oh, really?
Safeway was
Huge.
one. It's kind of like, and some are like I'm blanking on the name, but it's like a tier lower, like it's like a certain tier where it's like more regional and like local. So, but that's a good question. I think this one aspect is that with farmers markets, technically it's more like here versus with a farmers market or with a grocery store, there has to be a set number of people in this area for it to be sustainable, such as like why Walmarts aren't placed in like rural areas because the population density, this can't support making a profit. So that could be also a factor, but.
Yeah, I had a question about this, the last point you have on here about lacking health insurance. Just wanted to know how you're measuring that. Is that a binary 1-0 or is that counting, for example, government subsidized health insurance versus private health insurance? Do y'all bracket that out?
So for specifically the health outcomes, we're pulling from the CDC places data set. So where it's like a rate, or it's like the rate of people that they estimate have it or don't have it in that case. So for the primary data set that we use the GusNIP training, technical assistant, evaluation information, NTAE, pretty much. And what they do is more like a coalition where they like help get partners together. They're kind of like going back to the earlier question about like, is this a farmer's market individual or group of people? They pretty much help prepare people that are interested in helping, like, you want to get GusNIP, they help you prepare, get a grant, and those aspects. And in that data set, when we acquired it, it actually contains the list of addresses to every retailer that had it available from like 2019 to when we downloaded it in 2023. And it pretty much shows, okay, they're offering a SNAP incentive through, and it even details if it's like a specifically nutrition incentive for produce prescription. We primarily focus on nutrition incentive because of like our focus on like food access, farmers markets, and grocery stores. But from the time that we had it, there was 188 projects, meaning those are the recipients who received it. And among those projects was over 3,000 actual retailers. That was a mix of farmers markets and brick and mortar stores. And each address was so once we got it, we wanted to make sure that the addresses were actually like clean and these points were where they were, because I have a background in GIS. So when I geocoded the addresses, noticing, wait, some of these addresses are at the same location. That's because in some cases they were using the project's address versus the actual location where the retailer is. So we intentionally took a good amount of time, verified through Google where, okay, this farmer's market's name is here, or this address is here, verifying this address. And through it, we managed to get like over 2,000 observations. So our two key dependent variables, because we're primarily focusing on proximity to GusNIP retailers given demographic variables. We did it two ways. One was GusNIP count, which is understanding or counting the number of GusNIP within a census tract. And doing that, I just did summarize within census tract, kept everything at census tract level. And then the last one, which is important for tracts that don't have GusNIP stores, is a census tract's mile distance to their nearest GusNIP retailer. Because in some cases, and you're measuring it, you can see like how close am I actually to a GusNIP store. We thought that was kind of like interesting. And specifically for models with that one, we actually filter to focus on tracts that do not have a GusNIP store, because their distance will be 0, and that would bias like our results. So other data sets we used primarily for other SNAP allowable data set was the USDA FNS. They have a list of all like SNAP locations from like 1963 or actually 1930 to pretty much now. So we filtered and focused on all SNAP stores that were open, available in 2019 to kind of make sure that this is, to put in perspective of, okay, is this GusNIP store here because there's a lot of SNAP stores here, which would make sense. We also filtered for tracts that did not have a SNAP store or a GusNIP store, because it was actually a tract that did not have any SNAP stores, but had a GusNIP store. So we didn't want to bias in case there was no people living there, things like that, because that can be biased, like especially the mile distance. For demographic variables, we primarily pulled from the ACS data, and we used the 5-year estimates. So because we focused on 2015 and 2019, because these are GusNIP stores that were started in 2019. So therefore, their selection had been based on the past. And we pulled information from like race, rural status, car accessibility, education, poverty, controls, just to make sure like what are factors that are actually kind of like, why would should this retailer have a GusNIP store? And then going with the point made earlier, we use Places, which has local data for better health, which has census tract demographics for like centered on health outcomes.
Is 2019 the first year that they did this program?
That is another great question. So prior to this program, they had what was known as Finney, and Finney actually started in 2009 in Detroit. It was kind of like a pilot to this. So it became, this is where it became official, like GusNIP became official, but technically there were nutrition incentives prior to this. Essentially, these are the more documents.
Does mass transit destinations matter on the access? It's on a bus line or something like that.
It would, especially in areas like.
You have so many miles to the place. Are you referring to walking or driving or riding a bike or getting on the bus or what?
A good point. We primarily focused on car access, but public transportation, especially in areas where like New York City, that's where it will primarily be affected. That's a good point. So here's some descriptive summary statistics. I'm gonna make it easier and highlight the parts that are more interesting. So up top here, this is just more like the totals. So this first column showcases the total number of tracks in our data set. We also filtered out the states that never had a GusNIP store because that could bias our distance measures as well as it would always be zero. So it would bias our count measure too. Yeah. And as far as number of GusNIP tracks, we had over 3,000. And for non-GusNIP, the remainder 51. In terms of our key variable of interest, which was like non-Hispanic Black, but also in relative to non-Hispanic White, these are like the percentages we calculated in terms of like the total population in that track. And then the way it works is like you remove one observation like non-Hispanic White, and now that's the reference category. So the big thing to notice was like among total number of tracks, the average was 0.14% Black. And in our GusNIP track, it was just like slightly higher, 0.15. Same regarding like Hispanic and white, non-Hispanic White. And in terms of our controls, which we included, which was poverty, car access, the Gini index, rural status. What's interesting is for poverty, it's actually higher than total tracks and non-GusNIP tracks. Car availability is actually lower. And for rural status, 0.39, average was 0.39. And then for number of SNAP retailers, it's actually higher. It was like 10.9, meaning the point I made earlier about, what if they're just placing a GusNIP store in a place that has a lot of SNAP stores? On average, they're higher.
Is car availability saying that the household owns a car or they have access to someone else that owns a car? Like what was the measure to see? Because I know in some accessibility literature, they talk about how people can only go to the grocery store like once a month because they know someone with a car. Just curious what that measure.
For the car accessibility measure, I believe we use your commute to home work. So like if you had your commute to work saying like you have access to a car. And then point made earlier about public transportation, that's another variable we kind of use as well. So I'm a visual person and I like making maps. So this is a map that showcases where the GusNIP locations are by state from our demographic. The ones I highlighted ideally was like for California, where they had 352 retailers at the time we pulled the data set. North Carolina had the most, where they had 413. Ohio, technically, I could have highlighted Michigan because they were the first and started this, but I chose Ohio. 146 retailers are in Ohio, and I believe 246 were in Michigan.
So could we say, looking at your last slide, that it's actually pretty poorly targeted? Because if they were supposed to be targeting high need areas, I thought you said that was like a criteria. It looks like they're roughly similar on lots of these statistics. Like, I mean, poverty's a little baby bit higher, but not a lot. And,
It's in because another thing to highlight with the study is there hasn't been something regarding like what is high need or using it in a quantitative sense.
yeah.
So like what we're doing is showcasing like, if you look at the statistics or where things are located, what is the measure of high need and how are you quantifying it?
Yeah,
So
yeah,
that's
yeah.
one of the aspects that we're adding to the study. So now I'm gonna showcase it in terms of our interest, percentage Black in the tract. Not surprising, the South is a predominantly Black area. And because it's hard to kind of like see visually up here, but if I zoom in. So as I mentioned, GusNIP was originally and it was started in 2009 in Detroit. So here's predominantly Black area of Detroit. You can see a lot of like points there. For everywhere else, keep in mind of what I said, the main results I had prior. GusNIP location, we found that GusNIP locations are not they're less likely to be within a Black tract, but they're more likely to be near a Black tract or fewer mile distance. So for example, Chicago, which is a relatively high segregated city, seeing like that distribution. For New York, seeing some GusNIP stores in predominantly Black areas. For Atlanta, which is really interesting, seeing that their GusNIP stores are primarily congregated right here. and the predominantly Black areas are lower. For Dallas, Texas, they don't have a lot of GusNIP stores, which is seeing their proximity. And then specifically, what was interesting was seeing like LA, where you're seeing where predominantly Black area is, and you're seeing GusNIP locations somewhat appearing all around. So I mentioned that I'm looking at residential segregation literature, and our key variables of interest that we centered on, like I said, was like percentage, which is how I said the percentage of Black based on other races, like other race. And we're using white as the reference. So in all the results I'm going to show you, this is compared to a white population. Isolation index, which focuses on specifically a measure of exposure. So, and we're using county as like the broad scope of it. So it's the likelihood that I'm going to be next to somebody that is like me. So, and the idea is if it's 1, that means it's most segregated, 0 means least segregated. Similar to dissimilarity, where 1 represents most segregated, 0 represents least segregated, except for dissimilarity, it's compared to another race, which in our case is white, where it's the likelihood that you are by yourself, or that you're evenly dispersed. Like if it's pretty even, there should be an even mix, versus everybody's congregated here on the county level, Marietta County, that's like way to be segregated. So we ran models where we had this as our dependent variable, but one concern that we were thinking of was interpreting it, like the muddiness of like, how do we kind of like interpret it? So I'm gonna highlight what we end results are pretty much the same. In fact, some cases were higher, but the interpretation was a part that we were just like concerned with. How do we like say this is this? So some methods that we did, like I said, we focused on like association. So the relationship between the percent of a tract's population that identify as Black and their proximity to a GusNIP location. And how we did it, so we ran model, we have our controls that you saw in the summary statistics. But another part, given the results we had, primarily the fact that access was different or count was different than distance, we wanted to see if there's like nonlinearity or like filter by subsample at median. We also did to the upper quartile, just to see the extreme, but pretty much somewhat similar results, or stronger results in some case. But we want to be consistent. But we did that based on car accessibility, regionality, residential segregation measures I mentioned, health outcomes, which you're going to see, and distance. And you're going to see some plots, and each plot is its own individual model. That's something that's going to be big. And then for the econometric models that we used, we primarily, because of count data, SON models are pretty much good for count data, especially when we didn't suffer from the over dispersion, like we passed the test for SON. Otherwise, we'd have to do negative binomial. And then for the distance measure, we did ordinary least squares. And for both, we clustered on county level. We also did, we did some count, like fixed effects on the county level and did some random effects. For the most part, results remain consistent, but for the most part, and in some cases, we're debating on if it makes sense to do fixed effects in that sense. So we can talk about that, questions. So here is the main results, like the consistent part. Like I said, white is more like the reference. And then I didn't include the education variables because of I want to primarily focus on the ones that were focused. So I'll showcase this. Oh, and also for the access measure for the Poisson model, this is showcasing marginal effects versus the distance is showcasing the coefficient. So for Black, there are 4 percentage points less likely to have a GusNIP retailer in their tract compared to white, versus the distance measure.
I didn't mean to cut you off in the middle of your sentence. Oh, no, okay. So I totally get how this could happen, just given from your summary statistics. And it seems like the program is not super well targeted. Do you have some idea of which tracts or tracts are near tracts that have farmers markets? It's what if it's easier for this program to somehow successfully obtain funding if you have one of these already? And those are very poorly targeted or targeted in this in a negatively correlated way.
Yeah.
But like among the tracks that have that, maybe
Right.
they're to the scope, to the extent that they can, more appropriately targeted.
That's great, because we, right here at the bottom, we included like as a control, the number of SNAP retailers, which has the number of farmers markets in it. But then when we like specifically focused on the number of farmers markets, results were still like consistent.
I didn't even mean that. I meant limit the N to the tracks that have non-zero farmers markets. And I just ran this exact same analysis. I wonder if like the sign, like not undo what you did already, but just say like within the set of places that they could have them.
If most of the retailers are farmers markets,
Yeah.
then that might make, yeah.
Because the hard part was trying to conceptualize what's like the counterfactual, like, okay, this is showcasing negative, this is showcasing that they're less likely to have it when near. Conceptualizing, okay, what would be the similarity in a sense? Because are we trying to compare a Black population that's in, let's say, an urban area or Black population in rural? And we have these controls, and when we do this, the subsampling, which I'm gonna showcase, that's where we were kind of like trying to understand, because like, going with your point, understanding like, okay, this is underserved, but how? And what's the right demographic there?
And I also had a question about the interpretation of the Black coefficient. Is that moving from 0 to 100% Black in a census tract? Or do you have it coded where it's a 1 percentage point increase in the share Black in a census tract?
This is 4%, so this.
No, so being in an increasingly Black tract is because these aren't binary, your explanatory variables aren't binary, right? It's the percentage share of the census tract that is Black.
Yep.
So is it going from 16% to 17% Black is associated with a 4 percentage point decrease? Or is it going from 0 to 100% Black? Is a one unit, like, it depends on how you've structured your independent variable. Am I making any sense? Because that's a hugely different interpretation. If it's like tracks that have 0% Black versus a tract that is 100% Black, you see a 4 percentage point decline in retailers or fewer retailers, or is it 1 percentage point? And it just matters are you putting your percent Black in as 0.32 or are you putting it in as 3.2? Like, is it is the explanatory variable, and that'll help us interpret, unless it's a dummy somehow.
It's not, it's continuous, and it's point, like,
0.32?
yeah.
So then it's going from 0 to 1. So this is basically saying going from a tract that has absolutely no people who are Black to a tract that is 100% people who are Black is associated with a 4 percentage point decline, I think, right?
Yeah. I know like that, I know that's 4 percentage.
Yeah, yeah,
I just want to
yeah,
make sure that
yeah.
I'm saying the right points.
Yeah.
But, yeah. Because that was a point that we wanted to make sure when we were like rounding, but yeah, but the magnitude part is. And then something else that was kind of like interesting with this was also Hispanic showed similar results for the count measure, but not for, it was really insignificant for distance. And for other, like, significant and stronger for Gini index, positive, car availability, negative for access, positive for distance, which was interesting. So like, when we were looking at this, we were like, okay, let's dive deeper. So these are just showcasing like like I said, each individual model. I'm starting with the residential segregation. So the best way to kind of like describe this is Black versus white. This is the coefficient for Black versus white. And then what I did was above median. So I filtered based on if isolation index was above the median, as well as dissimilarity was above the median. And this line right here for the access or the GusNIP count measure represents if it's positive or negative. If it's negative, that means it's less likely. If it's positive, it's more likely that it will be in that tract. Versus with distance, negative is good, positive is bad, essentially. So what was interesting was specifically when we filter, like, specifically each measure by like the median or above, meaning like more segregation. For isolation, for the count measure, they're more likely to have a GusNIP store, meaning the isolation. Versus for distance, it was insignificant and distance farther. Versus with dissimilarity, vice versa. distance was the right sign. Ad count was not. When we look at it in terms of car accessibility, and something that I did because with car accessibility, that matters more if you're in an urban or rural tract or that percentage. So what I did was I did an additional filter based on if they're in an urban tract or rural. So this top part represents total based on car access, where red represents high, meaning good, you have high, good car access. Low represents low, you do not, like below median, you have lower car access. And what's interesting is, notice for the low car access for like the total, less likely, but their distance is way higher compared to like if you have good car access, meaning they're more likely to be placed in or like if you have low car access, you're more likely to have a GusNIP store near you or have a lower travel distance nearby. And then when we look at it for urban and rural, for urban, the low part was kind of like more stretched out, less likely, both less likely. But for distance, low was higher than for high and similar. So that was the part that was kind of like, it made sense that if I have low car access, I'm more likely to have a like easier, like I can get to a GusNIP store. In terms of our CDC measures, which was kind of like the public health measures, these were like rates. So like what I did was base it on like high obesity, less likely to have health insurance, high diabetes rate, higher blood pressure rate, because high blood pressure, and then high stroke rates. What was interesting was pretty much the results were all similar, where it was like less likely to have a GusNIP store in their tract, which vary by magnitude. But for distance, similar, but specifically for high health insurance, you just notice like an even stronger occurrence, like where it's like 11.79. And then in regards to distance, because we were really interested in like why specifically is the distance measured like this? Is it based on short distance, long distance? So we did an additional filter where we looked at if you are within half a mile, if you're within a mile, 5 miles, 10 miles. And for like the USDA, how they define low food access, they have various measures where it's kind of like one is based on half a mile, 1 mile, 5 miles, 10 miles, 15. And what was interesting was if you're in a census tract that had half a mile away from a GusNIP store, was actually positive, meaning you have to actually travel farther to get to a GusNIP store. For 1 mile, similar, even stronger. And then once you get to about in between 5 and 10, more than likely, I think it was like 7, but for 10 specifically, that's when it switches to like, okay, you're closer. Versus for 15, oh, you're closer. And then once you get to 20, you're closer. And we're thinking that part is like the urban rural part, where it's like if you're traveling 20 miles compared to like a white race, then you're going to be closer. So in regards to like policy implications and conclusion, pretty much we found like a high, like we just show you like association between GusNIP retailers and their proximity. Some part that we're thinking of in understanding like why things are the way they are is there's a suburban effect in there, where it's kind of like, this is saying that GusNIP locations maybe are more likely to be in like suburban areas compared to like urban versus rural. It's kind of different. So we were thinking about including like the RUCs, which includes like the urban or rural status based on like population, metro, things like that. But overall, the big things and the part that we think is the big contribution is one, showing quantitatively like, hey, this is an area that has like, that could have a GusNIP store, it has high need, depending on the need that you want to focus on, whether it's obesity, underserved minorities, car accessibility, poverty, and pretty much helping select like ideal locations or sites on that part. One limitation with this study is, in order to understand, like, to say, oh, this is improving diet quality, we have to have like how much they're purchasing and sales, which we don't. We only have availability of retailers. Also, in order to understand where they are in relative to like time, or not time, in the sense of I'm placing, like, I'm placing in this location, I do not know if people are actually shopping at this location, like an increase in sales. In a sense. So that's something that is another constraint that we want to like add to potentially like in the future. But in regards to the impact of this, there hasn't been a study that touched on specifically it from this angle, or specifically this program from this angle. And also competing with alternatives to GusNIP, which could also be in there, such as there's some programs that offer a max of $10 on additional $10 benefit on SNAP that may not be specifically GusNIP. But overall, we think it can help broadly explain like SNAP healthy eating. But that was pretty good.
I wonder if you're taking into account at all like organizational capacity in these areas. So for example, I did my research down in Southeast Ohio, and one of the things that the nonprofits I worked with did was facilitating farmers markets and actually applying to become SNAP and EBT vendors and then apply for GusNIP, just because there's like a big kind of leap if you haven't applied before. And so there can be kind of bureaucratic red tape. So I do wonder if in some of the areas where is low access, are there organizations within the area that focus on things like food access, food security, et cetera, that can kind of help deal with that, bureaucratic challenge?
That's a good, because like I know with the NTAE, their goal is to like educate people on that. But even then, like understanding like the time or understanding like in some cases it's like a disconnect where hey, we want to place this here, but will people actually come and frequent it even with the price incentive? Like my job market paper, which Dr. Wilson mentioned earlier, we touched on like how like trust matters, where even if you offer a price incentive, if I don't trust you, I'm still not going to go.
Right.
And that's where the people that you mentioned who know the community are impactful. And another point I'll mention is that the match requirement is also, we believe, is a major restriction too.
Yeah, absolutely.
Yeah.
I just asked about the financing, so sort of relates to that. Is it the case that it's just 100% of this is financed through SNAP? Or is there like some back channel where like a Medicaid waiver can exist in a state, and then the state can offer the GusNIP top up funds to the existing SNAP program? The only reason I ask this, I don't know if that's happening, but like it's pretty stark. Some states had like none, like North Carolina had a ton, and Michigan. So I was wondering if there was like some state program that was like making it cheaper, or if that's just like because community organizers or like it's like an interesting thing.
Yeah, I think because specifically for like the Medicare part, that may be more like the production, produce prescription lens or like food and medicine. But in regards to like why because with the implementation, I know that like Michigan was the first, and then seeing how like meeting somebody that touched on it in Texas or Oklahoma, and they're like, hey, how did y'all handle this? And talking with people that have had this for years.
So I think I misunderstand the finances. I'm sorry. So like you even said this in there, Michigan was first. Like, how could Michigan be first if it was a SNAP?
Oh,
So like a Michigan-based finance.
so it's like a
SNAP?
it's technically like a incentive towards SNAP. So it's kind of like you are, let's say that you like you're offering SNAP benefits and we're offering an immediate discount.
Sorry, you being the state.
You being the group, like the
Oh, okay.
like the
Sorry.
grant,
Okay, all right, yeah.
the grant person. So you're saying this, you're getting this funding, and then once you get this funding, you go to a retailer that's offering like SNAP and say like, hey, we want to fund you to offer an immediate price discount. And the way they market it as well is this is a win-win for both sides. Essentially, like how back in the, like during the pandemic with CARES Act funds, where people were food insecure, couldn't afford healthy foods. The farmers couldn't sell their produce, the farmers markets couldn't sell their produce. So it's kind of like, hey, we're giving you money to additional support. You're getting demand. It's like a supply and demand.
I guess so. Why do you see state level differences? Why isn't it like all popping up independently unless it's like these organizers or something?
Yeah, because there might not be an organizer in that state. Or because like, for example, there was a GusNIP one in North Dakota, South Dakota. But then when grant funding ends, then it's kind of like you can apply again.
Sorry, I think I'm like totally, sorry, I don't want. What's grant funding?
The states can apply or nonprofit organizations.
States can
Oh,
apply?
yeah, that's why
Apply,
there's
yes.
differences.
Governmental agencies can apply.
Oh,
So
really?
State government agencies can apply, local government agencies and nonprofit
So
organizations.
which of the states is the state the applicant? So I was actually thinking about the projects. You have 180 some projects. And so it's really the project level that would be really, it'd be interesting to see who are the applicants and how do they vary?
Yeah, we have that type of data as well as the amount, like, grant they funded, like, because that's available. The only part that's not available or that's hard is doing like state level variation, as well as we do not know how much money they spend. Like, if, let's say they get a grant for $300,000, or, that's low, but like, they get a set amount of money.
$1 million, yeah.
Yeah, they get a set amount of money. We don't know how much they spend at this store, this store, this store, especially if they have a mix of brick and mortar and
So
farmers
you have the
markets.
state as a project in here in some cases. So Ohio might apply as the state government or
Like
maybe
ODJFS could apply.
ODJFS could apply.
Yeah.
And then ODJFS is going to give it out to all the farmers markets in the state. If they, that apply to ODJFS, that kind of thing. So then all those farmers markets are your points that you're mapping.
Yeah,
But it's ODJFS.
and technically I could like showcase, like, if I can match based on the grant ID and like change the color where it's like, okay, like, for example, in Ohio, 30 of them were funded by this grant, 20 of them were funded by this. And I can show this.
But can you actually discern between, like, how much each of those 30 were? That's what you're saying, you don't have access.
You can't,
So you know it's 30, but you don't know versus, like, Worthington versus Westerville Farmers Market, who got how much.
exactly, you can't assume it's
But you
equal.
know who you're mapping proximity, that becomes really difficult to then.
The only way to know that would be to ask, and even then, that's kind of like if they give you that information.
I feel like you're in a really good position though, still, even if you don't know it'd be better to know the exact numbers. Let's say you know a grant exists in Ohio, roughly when that grant happened.
Yeah.
And one didn't exist in North Carolina. You're in like a classic policy analysis
Yeah.
comparison.
Yeah,
Then you can compare a community that lives by a farmer's market in
Right.
North Dakota, one that lives by one in Ohio, pre-post, and like see what happens. to
or
somebody
do an
that-
MSA even.
Oh, yeah, yeah, yeah.
Yeah, that would be
Right.
even better, like an MSA that crosses state lines, and this state had an ODJFS that was providing the farmers markets with funding, and this state didn't. And then you could even look at census tracts with farmers markets, as census
Yeah.
tracts with SNAP retailers.
It's fascinating.
Can you go back to the map? I wanted to follow up.
Yeah,
we do this conversation. Yeah, the one you just spoke about.
Yeah, that
really
one
interesting.
is really interesting, because I think there's a couple of different things I was thinking about here. One is certainly looking at the racial dispersions that you were kind of pointing out in terms of the South and just where things are located. Which is part of the conversation we were having earlier, like the enterprising states essentially, right? So North Carolina is
Yeah,
particularly
yeah,
enterprising.
yeah.
Ohio, West Virginia, I see also,
Yeah.
particularly enterprising, just for the number of population. And then other states not as enterprising or not as kind of mobilized for whatever reason. But then I wanted to go back to your urban maps, the 6 cities. And just thinking about the geographical dispersion and the different racial balances in each of these cities, and just wanting to think through, for example, the New York, Los Angeles, Dallas, where, you could probably put Chicago in there as well, where doing the black-white comparison might be kind of dicey, just thinking about the other racial demographics that are included in this. In particular with Los Angeles, just thinking through those patterns of residential segregation, right? Also have significant connections to the immigrant populations there. So I'm just thinking about, well, we were talking earlier about how my early work was on TANF, right? If you think about like who's qualified and who's not qualified for SNAP, I think that's another thing you might want to think about. So I'm thinking about it, particularly for New York and LA. But you could also make a case for Dallas, slightly different immigrant population, but still maybe relevant. And then, obviously in Chicago, there's definitely a Latino population that might be at stake.
Because I know like in the models, we include like the reference is white, but like the population of like white, black, Hispanic, other, kind of like including in there, and then with
What is
this, it's
controlled for foreign born or no? I mean, in the ACS, there's a measure you can use on foreign born. Unfortunately, they don't necessarily intersect, but you may want to take a look at that and see if there's a way to kind of build out. It's a very rough and not very helpful measure of, immigrant populations, but it's something that might be able to get you to qualifications for SNAP versus not, right? Because again, what you're thinking about when you're measuring just the black, white, or even the black, white, Latino, Asian American, Native, et cetera,
not everyone is US born, there, and not everyone has citizenship or TPS that would actually qualify them to have SNAP. So I mean, you may want to think about whether or not that comparison could be nuanced.
I do have a note on Los Angeles. I did some food research out at UCLA last summer, and I've done food research for many years. Specifically, a population's being missed in Los Angeles and other similar communities is the unhoused population. Because they have a significant disadvantage in like benefiting from SNAP at all because they don't have a permanent address. Like that's a huge problem is they're not able to apply because for SNAP, you have to continue to apply, right? It's like every 6 months or so, you have to continue to apply for these benefits. And if you don't have a house, you don't have an address, therefore you can't benefit. So huge population that's being missed in Los Angeles. And again, other communities who have a large unhoused or just housing insecure population, they cannot even benefit from these types of services.
So I don't want to get too caught up on the health insurance, but could you go back to the one that has the slide with your findings that has like the health insurance? Yeah. So do you have information on income, just straight up like income? Okay. Because
We have like ACS, like household, but we primarily focus on like the poverty part.
Right, which makes sense, but the health insurance thing, it's not the health insurance inherently is interesting here, but it's correlated with something. So like, why would that matter? And I think it might have something to do with the insurance gap, right? So if you are under, generally speaking, 138% of FPL, you're eligible for Medicaid. You're eligible for Medicaid, you are much more likely to have health insurance, right? If you have the kind of income and the kind of employment that allows you access to employer-sponsored insurance, likewise, you're much more likely to be insured. But folks who are in that 138 to 400, let's say, percent poverty, really it's up to about 600% poverty, but 138 to about 600% poverty level, those are the folks who are still quite unlikely to have health insurance. They're likely to make up that about 8 or 10% of the population still uninsured. And so I think like poverty is interesting, obviously, and important, but I think that uninsurance gap points to another sort of income category that isn't necessarily going to be captured by the poverty indicator. So I'm not sure kind of like how you might utilize that specifically in terms of using the ACS data to sort of find these subcategories, but that's an interesting effect, right? It's like, it's a weird thing to have happen. And I don't think it's spurious. I think there's something else going on there with income categories that's probably correlated with some of the other stuff. And I don't know enough about food literature.
But this isn't the coefficient for being less likely to have health insurance, I don't think. I think what he's plotting is the coefficient for the subsample that was less likely to have health insurance.
Yeah.
And it's the black coefficient of the subsample that was less likely, because I think so, but still your point holds, like, I think it's still, you actually want to see what is the coefficient, like, if we were to put that in a model, what is less likely to have health insurance by itself doing to the location of these retailers?
Right.
Maybe an interaction, but I think, tell me if I'm right, so each of these rows are different subsamples, so like, there might be a subset of 5,000 census tracts in that second row. And you're looking at the black coefficient there.
Yeah. And something else that I want to mention is because we wanted, and even when we included like obesity, because that was like one of our key variables. Florida, I forgot what the reason was off the top of my head, but Florida doesn't have any observations. So one factor with the reason why like it wasn't within like the main result model is because Florida has like a lot of like GusNIP stores. So it's kind of like, but even when we filter there, our results still maintain. So it just like minimize the sample. But even when we like, and with these, we did filter based on like, okay, no Florida, high, and yeah. But like I said, the more interesting thing was no matter for the most part how we kind of like flowed or did, and we took time to kind of like make sure less likely to have access, more likely to have like closer, like the nearby part. I was just trying to make sure like understanding like what we're not capturing.
But you've got rural and urban areas in here.
Yep.
So I think that's probably driving this a little bit, so like, I think that urban areas are more likely to have GusNIP. They're more likely to be in the suburbs of urban areas, but that's why the distance to a neighboring tract is less, but it's also why they're not in that tract, because they're in the suburbs. So I think I would definitely do a subsample completely of just urban areas and rural, and I mean, that distance thing, you did that, okay, yeah, yeah.
And it just kind of like just showed.
And it still does it, yeah, okay. But it does seem to me like that's picking up on something about that, because it was pretty clear in your visuals that they're in the suburbs, like, and if they're in the suburbs, then they're close to cities, but they're far from, I don't know.
That's why we're thinking of like using
Yeah.
the rucks where it does it by that. The only issue was how the one where it's dealing with census tract, it goes back to 2010. And technically, like, for example, like, I'm still like within 2 years of Columbus, but I feel like it blossomed, like it's bigger than it is since 2010. And everything else kind of like in terms of like 2019. And the most recent stuff for county, like it goes from 2010, county levels like 2013 or 2023. And it's just kind of like, which one do we kind of like use? It's kind of like. Comments or questions for like 4 minutes? I appreciate the questions. I got a lot written down right here.